I'd like to introduce Dr. Ankur Patel. He's a board-certified geriatrician. He's an author, podcast host. He's got quite a few podcasts you can listen, and especially you medical students out there, doctors in training, and this is something we'll talk about, having them come talk at the PIT meeting next year. He offers some really wise advice if you wanted to consider getting two professions. What I mean by that, being an MD first, but then an MBA. So in this world, I think he has a lot of experience there. I mean, he also does, primary care, or give me a break. I mean, he does acute care, post-acute care, nursing homes. This one program that I'm amazed with, that maybe a lot of you have heard about it, and that's a program of all-inclusive care for the elderly pace. He'll be talking a little bit about that. But I think I need to let you all know a little bit about Dr. Patel. Tell me about the CIA. I thought that was pretty interesting.
Yes. So my friends called me CIA, not because I'm smart to be in an intelligence agency, but I was born in Canada. I grew up in India, and now I'm in America. That makes me Canadian Indian American, and that's what my CIA stands for.
Super. So well diverse. So, I mean, real quick, I asked you to come in and this, what's the meeting is about being proactive versus reactive. And I know a lot of you, what you do is reactive, but you wouldn't have to do that if you could give us some advice about how to be proactive when we're treating, especially the elderly, how sensitive they are. And I've read some horrifying statistics about 350,000 of them out there are over medicating, they're having issues and problems, and they're responsible for more than half our hospitalizations. Tell me a little bit about what you're going to talk about, if you don't mind.
Correct. So I always say that, this is very near and dear to my heart, me being a pharmacist and a geriatrician. And what I have seen most of the time is the problem that happens from medication. And what I always say is it's always good to be proactive, means in geriatrics, we say less is better. And that's what the principle we stand for is less is better. And when I talk about polypharmacy or from that adverse drug event happens, adverse drug event, if it's a disease, is the fourth leading cause of death, right? And compared to younger adults, older adults are twice likely to go to the ER because of adverse drug event and 7 times more likely to be hospitalized from adverse drug event. And those are the things that hits the core where all of these things that we are talking about it, guess what? 2/3 of that are preventable. And that's what we will be focusing on in the talk.
So like they say, less means more. Less medicines means more life, more longevity.
Yes.
Some of the things like, prescription errors, there's a lot of talk about turning, a lot of these companies into AI, where they're going to start treating everybody like ones and zeros so they can, in a sense, minimize this. What are your thoughts about that?
So, I always say that, in medicine or any other industry, if you compare healthcare industry, we lag behind accepting technology compared to any other industry, right? So anything that I see, I never shut it down, but I always look with open eyes and embrace and listen it out that what is this technology, how this will help our patient. Will it, and again, and we always talk about it, Dr. Carter, right? Patient comes first. So if I bring in today or use this technology, will it help our patient? And if the answer is yes, I'm open to try it out. The second thing I always say is now how it affects me and other physicians. Is it something that I feel like I'm spending only 10 minutes with my patient and 20 minutes with documentation? That's a problem for me. But if there's the other way around where it helps me spend more time with patient and less with documentation, I'm always open for it. So things are changing. It's still up and coming. Time will tell how AIs will work in healthcare, and especially at a primary care level. But I would say that at least embrace it and see what's coming before kind of just blocking it.
Yeah. And coming from the patient's perspective and the information technology perspective, because that's sort of my background, it's a decision support system. It doesn't replace the decision maker, but it provides you with additional perspective, other possibilities, things that can help you in the decision making. And I think especially as you have non-MDs doing more critical care, things like that, that having these types of tools can really be helpful if they're viewed as a tool, not as a replacement. So I remember several years back, we had the folks from IBM come in and speak at one of our conferences about Watson. It was sort of the same kind of conversation. Is this computer going to take over? No, it's what in the information systems world would be called a decision support system. And I think that's really probably the best way to look at it.
You know, even with my EMR here with Cerner, I type in a medication, boom, you know, mild, moderate, or severe, or contraindicated list will come up. So that's AI right there already incorporated.
Yeah, pretty much.
But I have the final say because you and I both know that sometimes we use medications for their side effects a lot of times if it's beneficial. You know, everybody asks me, oh, what's the side effect of this medicine? And I say, longevity. I mean, you know, it's antioxidant. It basically absorbs, you know, inflammation. But anyway.
But you're right. So that's what I always say. It's, you know, the high tech will always be in healthcare, and I hope more comes in. But high touch is not going anywhere. And that's where us sitting with the patient and talking to them about answering their questions, right? So we always needs to be high tech, but never forget that we also need to be high touch.
So I know it's going to be a great talk because I've heard it from you that you're coming. I guess the last thing I'd like to do is just, you know, promote your book, because I mean, age is just a number. And I think just hearing some of the things and reading some of the excerpts from it, it's the same thing. In my practice, exercise is a bad word. It's activity. I said, because exercise is something, you know, from, you got to go to the gym, got to repeat. No, it's activity. And then I think the other thing that you touched upon is socialization. I think that is so more important that people get out. And then like the blue zone, you know about the blue zone, these old places of the world out there. The common denominator is gardening. Okay, you're getting outside, working with your hands. You're not growing animals. You know what you're putting in the soil, and then you have so much left over. You share it with your neighbors. Oh my gosh! I mean, it's just you know, makes sense. So you know, if you don't mind, maybe just one or two little things, since we have a minute or two, about your book, and hopefully you're going to bring some copies with you.
Sure, I will definitely bring copies of my book with me. But no, I think, Dr. Carter, you touched the point, right? Activity, when I say activity, it's not I'm saying to climb a mountain or work 20 miles or jog 10 miles a day. To me, I always say 30 minutes a day, 5 times a week of an activity decreases your all-cause of mortality by 33%. And what that means, we don't have any
medicines that good. I mean, come on.
And that's what it is. And activity means if you like to play pickleball, tennis, go for a walk, gardening, anything that just gets you out of the house and stay active, right? And then the other side of it is socialization. I always tell my patient that if you have 2 options, if you have an appointment with me or lunch with your friend, go for a lunch with your friends, because we can catch up some other time. And the reason I say that is because socialization has an impact on patients' health. And when the studies were done that they compared somebody who was social versus non-social, or more like isolated or lonely, they have 50% high risk of having dementia, right? That's it. That's the medication we are looking for, how to prevent dementia. Go out and socialize.
Yeah, you know, they say a hug is a hug if it's 45 seconds or longer. If not, it's just a pat. And it truly is. You feel better. It's so important. The last thing is we can't leave grandma out of this. And I think, you know, she was one of your mentors. And, you know, I had a 90-year-old patient, brand new, came to me, and I said, what are you going to see me for? I said, you know, if somebody did a good job, you're 90. He says, wow, I want to be able to talk to somebody, you know, when I call. I said, well, I'm supposed to ask you what the secret is. And she said, work. And that comes more and more, you know, and also having purpose. But I don't want to take away, but tell me just a little bit about, tell the audience just a little bit about your grandmother, please.
She was my mentor. She lived. My grandma is the reason who I am today. It's a lot I can talk about her, but I always say that, you know, she lived till the age of 93. She did not have any chronic condition, and she was not taking any medication. In a country like India, where health system or access to healthcare is nowhere close to what we have in America. So what did she do different? that we are struggling here with polypharmacy and talking about chronic condition. And when I think about it, that's what's going back to the blue zone. She didn't fall in blue zone, but she has socialization, helping others, devoting her life for others. To me, she was my Mother Teresa because I've seen her helping others, going above and beyond activities, so a lot of things. And I think sometimes it's just the spirituality and the positive mindset. That is one thing that I always say that I want to be, even if I'm 50% or 40% of my grandma's positivity, I made it.
That's awesome.
Great. Well, I do appreciate you spending the time with us, and I can't wait to listen and hear you in October. And I know there's many other people that are looking forward to as well. So
I am excited.
I'm going to go ahead and say goodbye, but